this episode of Making the Rounds, we're discussing a groundbreaking treatment transforming the way we address chronic tendon conditions in orthopedics and sports medicine, TenJet. The innovative approach is providing patients with renewed optimism and improved results. To learn more about this topic or other orthopedic-related services provided at Banner Health, please visit bannerhealth.com/orthopedics. Making the Rounds dives into medical topics with those who know them best, healthcare providers. My name is Bridget, and I'll be your host for today's episode. If you're new to our podcast, thank you for tuning in. And if you're a regular listener, welcome back. Joining me today on Making the Rounds is Dr. Elizabeth Batterton, a non-operative sports medicine physician at Banner University Orthopedic and Sports Medicine Institute in Phoenix, Arizona. Thank you for joining me today, Dr. Batterton, and welcome to Making the Rounds.
Thank you for having me.
Well, thanks for being here. Well, we are so excited to talk about this amazing new therapy that you are bringing to Banner Health and that you're bringing to the Valley here in Phoenix. Can you give us an overview of the TenJet procedure and how it works?
Definitely. So the TenJet is a small medical device. It's a 12-gauge needle that has a water jet and a suction attached to it. And through one single poke hole incision, doesn't require stitches or anything like that, we're able to do what's called a percutaneous needle tenotomy. We're able to poke a tendon through the water suction in these windows. We're able to suck in the diseased tendon, but not affect any of the good, healthy tendon to help promote healing for these chronic tendinopathies. As we do that, it promotes blood flow. It helps the healing factors come to those tendons. We're able to then kind of cover it with just some steri strips and a sterile dressing, and really start the healing process, and get people back doing the things they want to do with, very little downtime, really 4 to 6 weeks. They're able to get back doing all the things that they want to do.
What specific tendon injuries or conditions is TenJet most suited for?
So really, any chronic tendon issue is something that you can use this device on. I would say most commonly the things that I have used it for are lateral epicondylitis or tennis elbow. Golfer's elbow is on the other side of the elbow. Achilles tendonitis, plantar fasciitis, and then that greater troch bursitis or glute tendinopathy on the side of the hip that hurts when you lay on that side at night. Those are probably the most common things that we use it for that have great success and outcomes.
How long has this TenJet procedure been in practice?
So percutaneous needle tenotomy has been around for a long time. We used to, do the old school way, and some of my partners still do this, where they use a larger gauge needle and they poke at the tendon to help promote healing. We've kind of taken the hard work out of it. And this device, I've been using this now for about 5 or 6 years, to really help promote healing in a very minimally invasive manner that's not detrimental to the tendon. So again, we don't poke through any of the good healthy tendon. We don't injure any of the good healthy tendon. It's really just kind of focusing and targeting that diseased tendon that's not able to heal on its own.
So TenJet is described as minimally invasive. Can you explain what that means in regards to the patient experience and what that really means for outcomes?
So really, when we think of minimally invasive, we think of, small incision, little downtime. Really, this is an ultrasound image-guided procedure, so we're able to target our treatment area to the area that's the most diseased, so that we're not having to do a big open incision or a big, what we call a tenotomy, where they, take the whole tendon and kind of debride it and then put it back. So it's really, again, just taking that diseased part of the tendon and letting your own body heal the part of the tendon that's healthy. So again, one small poke hole incision, no sutures are required, and being able to do this under the ultrasound allows us to target that tendon in the treatment.
Can you walk us through that patient journey? So when do you identify that this is a procedure that's appropriate for this patient?
Sure. I mean, we can bring up plantar fasciitis because that's something that a lot of people suffer with. And that's probably one of the more challenging things that we have to treat. A lot of times, if we do nothing at all, a lot of times these chronic tendinopathies or issues will get better within 6 months to a year. Um, but even with doing some of our conservative treatments, anti-inflammatories, physical therapy, stretching, activity modification, sometimes still despite that, you're not getting better. A lot of times, too, with patients that this is something that's part of their daily life. So let's say you love running or you stand a lot for work, it can be devastating to not be able to do that. And so sometimes we kind of jump to this a little bit sooner, but a lot of times I would say if you've tried and failed some conservative treatment for, 6 weeks to 12 weeks and you're not making progress, this is a really great option. And really, you're maybe in a boot for a couple of days just to kind of protect that plantar fascia. And then you're back doing rehab within 2 weeks and really getting back to running or playing soccer or doing the things that you want to do and love within 6 weeks, maybe 12 weeks at the top end of it.
And in one of our other podcasts that we had with you, you had shared orthobiologics and PRP and the bone marrow treatment. Do these complement each other? Can you do one with the other, one or the other? Can you share a little bit about, because these are both key focuses within your practice, share with us a little bit about these patients that are a candidate that would benefit from TenJet as well as PRP, or how do you go about that treatment path?
So I definitely think there's some overlap between the patients that would benefit from TenJet versus, our orthobiologics or PRP. One of the things I like to point out is TenJet is covered by insurance. So that's a really great option that we have if cost is prohibitive to do some of our more, orthobiologic injections. The other cool thing about this is that they're both amplifying your body's healing response and setting it up to be the best chance of it healing. And so augmenting this with PRP or bone marrow is actually a really great option if you're able to do that. Because really, the TenJet or the percutaneous needle tenotomy helps to clean up the diseased tendon. So now you just have good, healthy tendon. And then the PRP comes and brings all those healing factors to that area to really amplify that healing response.
When you had shared with us that this has been in your practice for the last 5 years, what considerations went into integrating TenJet into the orthopedic program here at Banner University Medicine?
A lot of times, these chronic tendinopathies, despite all of our traditional treatment options that we have, do not heal well, and people suffer for a really long time with this. And then, even when we talk about surgical options for these, they tend not to have great outcomes, or the downtime is really prohibitive for people, and they're not willing to take that time or that rehab time to get better. And I have found that with the needle tenotomy, we're able to get people better faster, with little to no downtime. And really, they're happy with the results and they didn't have to have a major surgery. And again, for things that traditionally didn't do great with a surgery, we didn't have a good option for it. People do great with this. I always like to say another tool in our tool belt, to give people an opportunity to heal, with their body's own healing response. We just kind of help it along a little bit.
When you talk about the TenJet, how do you envision this procedure really shaping tendon care and sports medicine here in the Valley?
So I think one of the great things here is that this is not something that has really been offered here in the past. So the doors will be wide open to offer this to patients, because we just haven't had the opportunity to do that. So people that have suffered with chronic tendinopathy for, months to years and just haven't, been able to get better, this is something that we can provide. Again, covered by insurance, minimal downtime. We do it in the office, so you don't have to go to the operating room. You get to come in, you get to leave the same day, and hopefully get you better within 4 to 6 weeks. You're back doing the things that you want to do and love to do. I think it's really wonderful that we have something else to offer besides PT, and surgery. We have a new novel treatment that is getting people better.
Oh, that's wonderful. I love that it's in the office. Can you walk us through, all right, I'm a patient. This is my first appointment with you, and let's use plantar fasciitis as our diagnosis. And this is a treatment that we decide to move forward with. Can you walk us through that process from diagnosis to recovery?
Definitely. So if we decide you have plantar fasciitis, we've done the imaging that we, want to do or need to do and determined you have plantar fasciitis, nothing else, big, bad, or ugly going on. And we decide, you know what? Percutaneous needle sternotomy is a treatment for you. We schedule you for your procedure. You come in the day of, you take, a little bit of medication just to kind of help with pain control. We bring you to our procedure room under ultrasound guidance. We do everything sterilely. So you're not in the OR, but you're going to feel like you're in the OR. We numb everything up and using our little TenJet device, we basically, I like to say, power wash the tendon, or in this case, the plantar fascia. One of my athletic trainers calls it a water pick. It kind of looks like that. And you basically get to debride the tendon or the plantar fascia. And it's just through a single poke hole incision. So you get that covered in a non-adherent dressing. We protect, what we're treating. So if it's a plantar fascia, we put it in a walking boot. You can generally be non-weight bearing with crutches, but you can also walk a little bit in the boot. And then we follow up at the 1 week mark to check in and kind of see how you're doing. And then we meet back up in 4 weeks. You start physical therapy at 2 weeks, and really start to progress and advance as tolerated.
Can TenJet, Dr. Batterton, be utilized after surgical procedure?
It can.
It can.
It can. I have an example of a runner that tore her hamstring, and she formed a lot of scar tissue afterwards, and still had a partial Hickness tear of that hamstring despite having surgery. But she was really limited by the scar tissue. So we were actually able to go in and do a TenJet after her surgical repair of her hamstring. And we were able to debride some of that scar tissue so that she had more mobility and more function afterwards. I've also had patients that have had, hip replacements, and sometimes the location of that incision where you do your hip replacement, you have to go through your glute tendons and the muscle, and that can get really irritated. So a ton of patients get what we call bursitis on the side of their hip, which is really those glute tendons getting mad and angry. And this is something that we can debride those tendons and get them to heal after like a total hip replacement, and they do wonderful after that.
If you were to provide any advice for a patient that was considering TenJet procedure, what would you like to share with them?
Hmm. Do you want to get better and feel good fairly quickly and avoid, being down and out for a long period of time, and you've suffered with a chronic tendon issue for a long time, then this is probably a really great option. Risk is very low because we're not going after any good healthy tendon. So it's a pretty low risk, high reward procedure.
And I know this is a new procedure for Banner Health. So I would consider this a new up and coming advancement. But when you think about the future of TenJet and these types of procedures that we're providing, is there anything on the horizon when we're looking at any of those clinical trials or clinical studies? Any new advancements that you're working on currently?
I think it would be really interesting to take our percutaneous needle tenotomy device and compare the success and the pain outcomes to, PRP, but also to our old school way of doing a needle tenotomy. All of it would be under ultrasound guidance, but trying to compare, superiority of these and the addition of, the water jet and being able to hydrodissect those tendons. Do we have better outcomes with it? I've seen great outcomes with this. So clinically for me, it's been great. And there's some really good studies that support it. But I think comparing, our older ways of doing it or old school ways of doing it, I guess you would say, to some newer things that take the, guesswork out of it.
That's wonderful. Thank you for sharing. It's exciting work.
Definitely.
Thank you, Dr. Batterton, for sharing this groundbreaking treatment in TenJet and the future and care that you'll be providing our patients that are dealing with chronic tendon issues. So thank you for being here today.
Thank you again, and I'm very excited to be able to offer this to our patients here at Banner and across the valley as a new treatment option for chronic tendinopathy.
Thank you for joining us today. And if you found this conversation as informative as we did, please subscribe to our podcast for more discussions on important medical topics. To learn more about Dr. Batterton and the orthopedic services provided at Banner Health, please visit bannerhealth.com/orthopedics. Thank you for listening, and we'll see you next time on Making the Rounds.